So hi everyone and very good evening to all of you. As the NEET exam date, as the result has date has come, we all are quite anxious and we all want to prepare well. I'll not take a lot of time today and literally come back to time. The basic thing you must understand right now is every single minute counts. So we should make a plan which suits our own self and more importantly, it suits the entire preparation we have done throughout the years. So very good evening to all of you who have joined right now and I hope that my audio and video is clear. Uh, let's see very much this will be a time when you all are anxious. For the last few days we all have been going through such a lot of things and we have wasted our time, but koi baat nahi. Since we all have done that, and eventually I'm telling you most of us has of us has done that. So what we can do in the next 7 days, we can use our time to the best of the best utilization potential. Agreed? Dekho, let's understand one thing. We cannot do everything right now, but what we can do is we have to cover at least the NEET MCQs, we have to cover the NICT MCQs, and we have to cover that notes that we have read. So I have a few things to tell you. Number one, choose your sources. Again, get back to the sources that you have read. No, literally no new sources should be read right now. Point number one. Secondly, sir, can I do it? Because everyone is now, doubting himself or herself. Is sir, can I do it right now or not? Now, I'm a person, when I was preparing in Gautam Nagar for the last few days of my preparation, every day I told myself, can I actually get even a secure rank or not? But believe me, when I cracked into AIMS, I was not believing my eyes. So last few days, I can tell you, is the most important time of your preparation. So can you do it? Everyone here can do it. It all depends upon mindset and how you train your mind, how much confident you are feeling right now. The confidence should be really very high, and more importantly, you should prepare to the best of a potential without wasting any time. Please listen to me, everyone. If you're at all doubting yourself, then I believe that you don't have it in you. You literally have come so much far. The exam is just 7 days, so let's not discuss this thing. Can you do it this time or not? Everyone can do it. The only thing that depend upon is whether you have that positive framework of mind or right now or not. Okay? So please tell yourself, I can do it. Okay? Now, how to do it, what to read, what not to read, let's talk about that. Okay? Please do not put any negative thoughts in you, because that is what we can do right now. Okay, please do not panic, please don't put any negative thoughts, and importantly, let's try to cover those previous questions which have been asked and will be asked again and again. So guys, please समझो एक बात को, do not put any negative thoughts. We all are in the same boat. I can tell you, I have got almost 600 messages today, and everyone feeling the same heat. कि sir, I have literally not able to remember anything from the notes. बेटा ऐसा नहीं है, because you are telling your mind that I have literally wasted a lot of time. Your mind is telling you I cannot recall anything. Please give your energy, your positive energy to mind also. The moment you tell your mind you can do it, your mind tells you, okay, let's try it once. एक try तो करो. Let's fight the battle and then tell yourself that you may not do it. Okay? So right now we have 7 days. Every day has 24 hours. I will ask you to read at least for 15 hours a day. Okay? Okay. अब देखो, in the NICT exam, were you able to read 200 questions? If yes, first problem is solved. The time management is good. Okay. Now, two things I'll tell you before I move forward. When you read a question and the options, if you don't know it, when you move to the next question, do not start thinking about the previous questions. This has happened to a lot of students, that when they're reading the questions once, they go to the next question, they're still concerned about the previous question which they have not marked. Guys, think like you're sitting in the OPD and let's deal with 200 patients now. When you move to the next patient, don't think about the previous patient. Think about the next patient. Please put this into mind when you're solving the questions right now for the next 7 days. So guys, rule number one, confidence. Rule number two, do not take any new resources. And rule number three, don't overthink. Okay. Now, once you can do it, let's now move forward. Okay. Dekho. So I have made a basic plan to you, and I'll tell you what you can do eventually to come out as a actually what you can do maximum to utilize this time. Okay. Dekho. Guys, 1 second, please. If you have any thoughts, please put it forward while I'm just telling you what all you can do it. Okay. So Dekho, I hope this thing is clearly visible to you. And let's start with what all things we can do to use the best and best of our resources. Okay. Dekho. So coming back to first thing I want you all to do. Number one is please have the confidence in you. Guys, please do have the confidence in you. See, the moment you put a confidence factor in you, you will always believe that, yes, sir, I have read this topic and I can really do better. Okay. Now, the time factor is very important right now. Please understand that the amount of timing that you should read now is 15 hours. Divide the timing into few time. Like for example, get up at 6 a.m. in the morning. Okay? I'm talking about this time factor right now. So when you read a time factor, in this time factor is very essential right now. What you can do is this time factor will tell you to read 15 hours. That how can you divide it? Wake up at 6 a.m. From 6 a.m. to 1 p.m. is your first reading. 1 to 2 is your rest time. So I'm writing it down right now. What you can all do is this is 6. Okay, 6 to 1 is one time frame. From 2 to 6 p.m. is second time frame, and from 7 to I'll say 12 is a third time frame. Okay, what you must do is take a break after every 2.5 hours, because NEET PG paper will be of at least 3 hours. So you must at least be able to sit for studying for 3 hours, because else you will not be able to concentrate that much. Okay, so this may not be possible be on the day one, but as you move into days two of a preparation right now, because I'm considering 7 days only, then you must sit for at least 3 hours in a single stretch. Okay, so 6 to 1 is my first time frame. You can take a break of 15-30 minutes in between for your daily chores and all. Now, what you must do right now is look at the previous year questions. Now, I cannot give you same advice for everyone, so I've divided them into main things. Number one, for those students who have actually read the NICT questions and the NEET paper questions, if you have time, you can solve the UPSC questions, but that means that you should have the paper and the solution with you. If not, don't bother about it. But if you have, you can look into that. How much UPSC papers? 2 years, last 2 years UPSC paper may be useful for the upcoming exams. But if you have not read it, don't worry at all. Okay, don't worry about it. Just forget about it. So right now your focus must be at least to cover number one, the NEET MCQs. Okay, now how to cover, I'll tell you. See, what happens sometimes when you read a question and you don't know the answer, you tend to read all of the explanations. See, first of all, look at those point of explanations which was solving the main answer. Okay, try to search for that. Once you have searched this and you are now confident about why the option was not A or B, just move to the next question right now. Maybe you don't have that amount of time to read every point of explanation, because in that way you will not be able to complete even a single paper on a single day. But we have to cover at least 3 years of paper of NICT, 3 years papers of NEET, and if the time is permitting, then you can go for the CMS papers. So point number one is done. Second, sir, should I go for notes or should I watch the LMRP or any rapid revision video series? Number one, देखो बेटा, no time to read any new resources. Please understand this. There's no time to read any new resources. So limit your resource to one thing which you have already read. Have confidence in your notes if you have prepared it. Have confidence in the notes if you have read it. So take out that notes again. Try to read those points which you've highlighted it again, and do not read anything new. The more you want to, you may be reading it, but ultimately, if you're not able to finish it, there's no point reading it. Okay. So try to come back to the notes, read them, and try to cover them here. Okay. So, sir, shall I stick to the notes? I will say, yes, you can stick to the notes. Nothing new. Nothing new. Okay, we are now moving to this point. So, yes, I'll ask you to stick to the notes. Okay, this notes will be most essential right now. The notes will be more essential right now, but nothing new. This is the most important point I want to make you understand. About the videos, please understand one thing, guys. Suppose you are thinking, or you might have planned this point from the video I'll read it the last week. That's pretty fine. But don't start watching a video right now. There's no time for that. Just 7 days, guys. Please understand this point. And what you can do right now is maybe reading the notes that you have prepared or the notes that you have read. So do not watch any new video. It will not help you. The more you want to, it will not help you. I'm telling you. Okay. Now about the grand test. Guys, anyone who has been scoring around 130 or 140 plus in a grand test, they can give at least two grand tests. Okay. So 2 GT can be given. Okay. 2 GT can be given for those students if the score, the 2 GT, sorry, 2 GT can be given if your score has been, if your score, it has been over 140 plus. Okay. But for anyone who is scoring less than 130, don't give a GT, because that will decrease your confidence. And right now I want confidence in all my students. I want your confidence. Okay. But suppose you are scoring more than 130 plus in the overall GT, 130 or 140, 130, 140 or more than 140, you can give 2 GT on the days. It can be Tuesday or Thursday, but not beyond Thursday. Okay. Then about the practice questions. So everyone right now must practice questions in a time frame manner. Please remember, the practice question should be done in a time frame manner. What does it mean, sir? It means that you cannot just solve a question and look at the question, look at the answer. That's not right time. What you can do is look at the question, at least solve 20 of them, maybe anatomy and physiology can be done together, and then look at the explanations. Or even better is try to solve an entire 300 questions. It was previously, now it's just 200 questions. So try to solve entire 200 questions from a previous NEET paper in a time frame manner. See how much you get. If you've solved it, koi baat nahi, do it again, koi baat nahi, because all the answers should be in your fingertips. Once you've done that, then look at the options or explanations. What one you can do right now is, suppose you're reading a question, you don't know the answer and you have a doubt. Try to write the same point at the time of solving the questions. Okay, so take a paper and a pen. Suppose I'm solving question number 6, and the question number 6 is supposedly on a fish technique. Okay, and you don't know about the fish, just write in during solving the questions, write fish. So this, when you move back to the reading explanations, you can literally save time and read about this technique in the explanations and not read everything else. It will literally save a lot of time while solving the questions. Okay. Beyond that, about the sleep pattern, please change your sleep pattern. Sleep at 12:30, wake up at 6:15, and start sitting on a study table at 6:30. Do not wake up at 8 a.m. right now. Okay, change your sleep pattern, guys. Get out of your bed and start sitting on a study table at 6:30 a.m. from here onwards. Okay, and the same thing should be done again on the next day. Now look at the next one. Guys, what should be done? How can you revise it? So anyone who has prepared over the last few months, देखो एक बात समझो, what is preparation? Preparation will be never complete, because it's MBBS preparation. You cannot complete a subject, you cannot complete 19 subjects. So preparation will always be incomplete. Even a topper thinks I could have read this thing extra. Even the first ranker thinks so. Okay, but if you are thinking only about qualification, that's the best way forward. So what you can do is, to qualify or to get a decent rank, to qualify for a clinical seat, think about solving your own notes. The more you try to read your own notes, sir, now the question is, sir, you are saying notes, 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 sir, how can read notes in just 7 days? Please समझो एक बात को. I'm not telling you to read everything. I'm just telling you to read the highlighted point of the notes. So how to read highlighted points? Sometimes students say, sir, whenever I want to read the highlighted points, I want to read about the points here and there also, because I feel that is also important. Yes, that was important. But right now, what is more important for you is to read the highlighted points, because those are the things that you actually forget. Okay, and have you made that 20th notebook we talk about, that extra copy in which you want to write it, extra points? This is the best time. You must start revising it now. Okay, start revising that extra point in your 20th notebook. This is the right time to solve it. Okay, so coming back to what you can do is how to revise notes. So if I am in your arena, I have also wasted a lot of time in postponement newses. What I can do is, let's take out surgical notes. Okay, now in surgery, what all to read, I have given that PDF in which I've shared the important topics. So I think it's not right time to again look at the PDF, because that's very vast for you. But suppose you feel that you're reading surgery, and you all know the maximum question from surgery, it actually comes from the trauma, breast, and the thyroid and GIT. Start from trauma. Okay, now in the trauma notes, just go and look at what all scores you don't remember. Gaze through that. इसको देखा, Just close your eyes and just try to remember whatever you remember. Your mind is blank, koi baat nahi. Open it and read it once. Flip the page and go to the next point. Your mind should get that extra information. Yes, it will be very, very tough, but I can tell you the best thing about right now is you have to remember stuffs only for the next 7 days, not for 7 months. This is the best time to take out so much facts that ultimately you can actually replicate those things in actual exam, because you want to retain this only for the next 7 days and forget about this after the 7th day. Okay, that's a good thing to happen. So at least read those stuffs. The moment you tell your mind, there's so many notes, I don't remember anything, your mind tells you, chhod do na fir. And I will tell you the same thing. If you don't have it in you, why are you actually going to become a doctor? You all have it, right? You all have it because you all have done MBBS, guys. You all are doctors right now. You're quite matured right now. थोड़ा सा पढ़ो, अपने resource को channelize करो. Just channelize your resources. Tell your mind you can literally do it. And I can tell you, every one of you have capacity to do it. What about this 7 p.m. to 12:30 a.m.? So I want you all, for those students who have not solved or uh, may have spent some time quite before in the NEET questions, try to solve 21, 20, and 19 at least. On the 17th, try to solve NICT 21 and 22nd year of the NICT. The most of the things were recalled by the faculties, and I hope that you have the PDF. Try to recall all those, read this question and the answers. Okay, if it is possible, on the same day, try to put the NICT 20th, NICT 2020 questions also. Now, when I say 21, I mean both the sessions. I mean both sessions of NICT 21. I don't need, I just telling you only a January or a June session. Okay. Now, from anything coming out of this must be then read on the 18th. Okay. It must be then read on the 18th. That means, suppose I'm telling you, for those students who are actually trying to score very good marks, suppose you want to read a new topic, please don't put it for the last few days. उसको अभी पढ़ डालो, next few days में पढ़ डालो. Don't leave for the last days. And for those students who are solving this right now, I have a better solution for you. Suppose you are again marking something in this day, and this day. So whatever new comes, you have to read on these 2 days in the evening time. Okay. Suppose you are solving a question on, suppose, trauma, and you don't remember a scoring system. Come back on 18 and 19, again read that question. I'm telling you guys, NEET में ना topics are repeated very frequently. Okay, the options are not so tricky as was in NICT. The options are known options, and the only students who actually believe in themselves, they are the one who can actually crack it. So I believe that if I can believe in you, अपने ऊपर faith तो रखो. Everyone is waiting for you to get a rank, to get something good in your clinical fields, right? And because everyone believes in you, please have faith in yourself. Ultimately, on the 20th, we'll only relax, not do a lot of things here, but only the 20th notebook which are prepared. Try to read it here and here, here. Okay. Now I'll just take a few of your queries and I'll just wind up today because we all have to study. So from tomorrow, I want all of you to start reading the notes from 6:30 to 6 p.m. That is 12 hours here, and post 7 p.m. I want to solve the questions. So here yahan par question and yahan par the notes here. But I'm telling you guys, nothing new. Nothing new should be taken right now. It will not be a good idea to take something new. Okay. So how to revise? I'll just take a few questions which I've asked it here. So guys, what are the chances of questions getting repeated? There's a lot of chance getting question getting repeated in the NEET questions. NEET questions are often repeated. So if you ask me, around 40 to 50 questions will be repeated from the previous year, maybe NICT or the NEET questions, and 150 will be new questions, but the already repeat topics. Okay, sir, I have done 2 revisions. Wonderful. And I can't recollect many things while I do a GT. कोई बात नहीं. That is why you want the one more revision. एक और revision करो and just appear for the main exam. If your score is not beyond 130, don't give a GT right now. Okay, GT is for those who are scoring more than 140 plus, because that even they score less, they have a full amount of confidence from the previous GTs. Okay, and they can carry it forward. Sir, should I solve subject by question or a mixed bag? But a mixed bag. Okay, it should be mixed bag. But suppose you are getting suppose the book consists of a question from 1 to 200 arranged in a subject wise, try to solve from question 1 to 200. Don't jumble it up. But if you're solving from app, you can go obviously a jumble back. Okay. How many times should I revise the 20th notebook? It all depends how much confident you are in the 20th notebook, because 20th notebook, that means those volatile topics are those which you forget a lot. So try to make that very familiar to you. उससे ना question आता ही आता है, because they're tricky questions and everyone gets faltered in the tricky questions. Okay. Should I go for rapid revision of Marrow? If you have covered it, if you watched it once, surely do it. Surely do it. But if you have watched it once, okay, looking at the NICT recall video is taking a lot of time. So don't look at recall video. Na? Almost every faculty has now shared the PDF. Look at that PDF only here and there. Can we do a combination of TND, Vibe, GT reviews? Are perfect. That is the perfect thing. In fact, for those students who have actually appeared for the TND, I think for them the revision on the TND will also be a very good idea. Will also be a very good idea. Revision of the TND videos will also be a very good idea. Okay. Yeah. I'll just take a few other questions. Sir, what can be done in biochemistry? Especially biochemistry now, overall, everyone is weak in biochemistry. So don't worry about this a lot. What you can do is at least try to revise the lipid cycle, the glycolysis cycle, okay, and the protein synthesis. That's it. The carrier transports, those are very important there. How to overcome the stress and tension? देखो, please understand, stress or tension है, सबको है. But stress and tension will be part of your life even when you do a PG. And even it will be more when you do a PG. So stress and tension is part of the life. Enjoy it. Don't stress yourself to the extent that you're not able to read it. Okay. What about vibe? But if you have watched the vibe session and made the notes, बस notes देखो. Vibe के videos नहीं देखना है. But suppose you have not watched the vibe videos and you somehow have the vibe notes with you, do that. Okay. Sir, doing 19, 20, 21 PYQ sufficient? देखो sufficient क्या होता है? By doing this, at least you can qualify for the NEET exam. And who knows, a few question comes which you know better than others. Boom, you get a good rank. That is what actually happens in a PGME exams. After true revision, I'm not able to recollect many things while doing a GT. Please advise what can I do wrong with the preparation. There's nothing wrong in a preparation. It is just that you're reading so many things in less amount of time. So when you read so many things in less amount of time, you'll remember it for lesser time. But should you stop reading? No. But abhi padhna hai, 7 days tak yaad rakhna hai, and then you have to forget it. So please read, please study. The more you study, the mind will tell you, okay, I have a huge amount of confidence. Let me read more and more. Start to karo. Okay. Sir, an NICT question, after reading a few questions, found it difficult and became anxious. That is what I'm telling you. The anxiety can come, but anxiety karana, when you read the next question, forget about the previous questions. Yes, this is very important. And how to practice? Next 7 days mein hi practice karna hai. Suppose you don't know the previous questions, move to the next question. And therefore, you should solve the question in an exam environment. So when you sit at 7, get up off your study table only at 3 hours, or when you complete it. Don't get up before that. ऐसा नहीं कि you're reading a question, you're going here, there, watching something, seeing something. No, it should be in the practically exam environmented time. Okay. रोस्टर बेस्ड रेसिंग का टाइम नहीं अभी डिस्कस करने का. FMG पेपर आर इंपॉर्टेंट ओनली इफ यू हैव कवर्ड नंबर 1 नीट, नंबर 2 NICT, नंबर 3 UPSC. Only then you can look for the FMG papers. Okay. Should we do the previous year subject wise question or the whole PYQs? I will say PYQs can be solved either subject wise or a mixed bag. It depends upon how to revise it. So suppose you feel that at least I can cover the entire PYQ from this book, then you cannot jumble it up, right? But if you're solving on the app, then you can jumble it up. And jumbling up is also a very good idea. That's perfectly fine. That's perfectly fine. Okay. Instead of notes, can you just watch the revision videos? No, Q. Have you read the notes or not? If you have read the notes, but trust the notes. बता रहा हूँ. You'll remember the things from the notes. यहाँ लिखा था, यहाँ लिखा था. But video में क्या होगा? It will consume a lot of time when you're reading the videos. Okay, so reading, just watching a video may not be a very good idea. I believe that the notes that you prepared over the time, and even if you read it once, usko kholo, usko padho, it will be better. Okay, TND question plus important topics, perfect. How to deal with negative thoughts and anxiety? Negative thoughts nahi lana hai beta. Last few days mein na, you should tell your mind, I can do it. Forget about everything else, and anyone who tells you the time is lost, stop speaking to them. Stop speaking to them. Are they so much important in your life? The person who's telling you that you cannot do it, how is he important to life, important in your life? I don't understand. Usko na, just shut him out of your life for the next 7 days or 8 days. So anyone who tells you you are of no worth or you cannot do it, don't speak to them. Don't even look at them. Don't even think about him or her. Okay. How to do rapid revision of systemic pathology? Take the main subjects topics: GIT, renal, vessels, and the images of the thyroid. Bus. It will be done. Okay. I'm a dropper, so much pressure to get good rank. Everyone is in a pressure. Dropper chodo, a fresher is also in the same pressure. Everyone has the same pressure. But that doesn't mean you will at all feel weak. Okay. So not able to concentrate, koi baat nahi, I'm there. I'll push you and push you again and again so that you keep on reading. Okay. Yes, you can go to the PDF that I've shared with you, but that only if you read those topics, because that that becomes huge right now for the last 7 days. So I'll not actually advise you to watch it or read those in all those topics, because that is really very, very huge. Okay, what should be done to just qualify in these 7 days? Just solve previous year questions, and based on that, read the topics which you don't know at all. Best of luck, you'll surely qualify. Okay. Sir, I don't think know about anything, though I have revised it many times. देखो ऐसा होगा. It is your thought process that you don't remember anything. But the moment you start reading it again this week, it will really get you a lot of confidence. It will really get you a lot of confidence. Okay. The topics which you have given as important reading, would that be sufficient for revising notes? 100% yes. 100% yes. But only if you read it, don't take a new resource to read a new topic right now. Okay. In this less time, can I do only previous question the last 4 years? Yes, if you are not able to revise the notes, or supposedly you have not read a notes or not prepared a notes, I think that's a very good idea. That's a good idea to solve at least 4 years previous questions and the topics perfectly. That's a perfect thing. Okay. DAMS, DBT and TND enough? Well, I'll say that's really good. That's good enough. Only if you've read that. So have you watched the videos or have you attended the TND? You made the notes? पढ़ो ना उसको. जो भी पढ़ा है उसको पढ़ो. Don't take anything new. And have the confidence that what you read it, कि question वहां से ही आएगा. And let us speaking, because every faculty is good and every faculty is from his heart. Questions ना उसके notes से आ जाता है. I believe that because it has happened to me. And over the years, I've seen happening to so many students also. Okay, because always you see the topper always says the question from the notes, and the person who is not confident will always say the question will completely out of the notes. How is that different? Because topper has read his notes again, again, and again, so he knows the question are from the notes. I hope you get the point. So how much score in the NICT? That's a different story altogether. Let's the result come and we'll then see it again. Okay. So timetable for subject wise, देखो why I'm not giving a subject wise timetable, because it all depends upon how much weak you are in a particular subject. Suppose you are weak in gynae ops, take gynae ops tomorrow. Suppose you are weak in pediatrics, take pediatrics tomorrow. Suppose you are weak in surgery, take surgery tomorrow. So the more the weaker you are in a subject, take it tomorrow. And let's not be taking that on Thursday. Therefore, I'm not giving you a subject-wise 7 days program. I want you to trust your notes and the rapid revision notes, whatever you have prepared, or the TND notes in the morning time. And after 7 p.m., I want to solve the questions, and that to the previous year questions only, not a new resource of questions. For anyone who have just solved or getting more than 140 plus constantly in the GT, surely appear for the GT also to surely increase your confidence there. Well, if you feel that बर्बाद हो गए यार, बर्बाद कैसे हो गए? You're a doctor guy. You are a doctor. Even if you don't do anything in a PG or something, you still are going to do very good in life. You're still going to do very good in life. I'm telling you. So don't worry. It is not a time to worry. It is just time to hurry a bit. Okay. So guys, थोड़ा सा पढ़ो. Please feel confident. I'll not stretch it too long because all of you have to study a lot today. So I'll not take a lot of time for you. But what I can tell you, I'll just share my own experience. I'll just take up some water, please. The last few days when I was preparing, every night when I slept, I thought, can I do it? Every night I thought this. And you know what happened? The day before the exam, I really wanted to quit. But when I got into AIMS, the only thing that kept on pushing me was one idea that ultimately I should give an exam with the best effort because I am a doctor and I should behave like one. When you see a patient, you don't run away from him, right? You treat him. So because you know a lot of things from the previous stuffs, the questions will be from your previous read topics only. Have faith in yourself. Okay? The next few days are literally very important. The moment you start wasting your time, your mind tells your heart, I am literally weak. The heart tells your mind, he cannot do it. So, beta, please read. This reading will give you confidence. That confidence will tell your heart and brain, you'll surely crack this NEET this time. Okay? Even though things are tough, but it's tough for everyone. And everyone is the same boat. The person who prevails, the person who feels confident right now, keeps on putting his momentum. That will, he will or she will come the winner. And winners are always from this pool of students. They're not new. They will be one from you watching this video right now. They will be the one who are topping, getting the exam in the best results. Why it happens? Because they have a positive energy in themselves and they believe in themselves. They can do it. The moment you start wasting your time, it will not happen. I tell you, it will not happen. Suppose you stop watching this video and again go to literally searching something else in YouTube, better it is gone. It is literally gone from your hands. So get rid of some of the apps, best time. Get rid of some of the distractions, best time, and come back on 21st to enjoy your life coming ahead. Okay, guys? So wishing you all the best. Please start reading. Do not watch anything else right now after completing this video. Please read. I have a lot of faith in you. Usko padho and surely will do the best. Okay, maybe we can talk it also in some other time. I'll put some videos, motivation videos for you, how to keep on motivating and reading for long hours, and how to motivate yourself because that is what is required right now. And let's see how it goes forward. Okay, so with a smile on your face, padho. It'll really go fine. Don't worry about anything else. What has happened has happened. What will happen is in your hands. So let it not go to waste. Okay? Take care. God bless you all. Goodbye.